Welcome to the Institute of Humanities in Africa doctoral seminar, where these sessions are designed to provide an introduction to the intellectual grounding and guidance on the practical tools of the doctoral journey. My name is Angelique Thomas, and I am a doctoral fellow within UMA. As an additional note, I would like to mention that many Zoom users have experienced the unfortunate occurrence of Zoom bombing. To mitigate these issues and to try and reduce the risk as much as possible, we ask that all participants kindly change their profile name to their full name and affiliation, or pop those details into the chat box. You might find yourselves temporarily placed in the waiting room otherwise. So today, we have the pleasure of hosting Dr. Leslie Gittings on the topic Participatory and Art-Based Approaches in Health and Development-Related Research with Adolescents and Young People. By way of introduction, to our guest speaker, Leslie Gittings is a postdoctoral research fellow at the University of Cape Town and Toronto. Her research focuses on HIV, gender, and the sexual and reproductive health of vulnerable and marginalized adolescents using participatory and arts-based approaches. Leslie holds a PhD in public health and a master's degree in public policy from the University of Cape Town. She has 15 years of experience in HIV and health research and practice in sub-Saharan Africa and Canada. Leslie, we are thrilled to have you and we're excited for your talk. I will now hand over to you.
Angelique, thank you so much. And thank you for having me here today. I'm really excited to be chatting with you, and I've heard lots about your program and your work from Angelique. So before we get started, I just wanted to get a sense of who is in the room in relation to this topic specifically. So if you could either raise your real hand, or if you're off camera, your Zoom hand, if you have conducted or plan to conduct participatory research. Okay, so it looks like we have 2 there, 3, okay. I see a clap. Could we do the same for anyone who is planning to conduct arts-based research or has conducted arts-based research? Okay, great. This is awesome. I feel like I'm in the right place. And then the last one, if you have worked or plan to work with adolescents or young adults. Okay, great. And so it seems like a range of interests and experience that is really related to some of the work I'll be sharing today. So I'm excited both to share as well as to learn from you. So I'm just going to share my screen here. Let's see. Okay, can everyone, Ange, can you see that okay? Yes? Okay, great. So like Ange said, I'm a postdoc both at UCT and the University of Toronto. I'm Canadian by birth, as you can probably hear by my accent, and I trained at the University of Cape Town, and I lived in Cape Town and the Eastern Cape for about a decade before moving back to Canada during COVID, which is where I am right now. So what I wanted to do today is really start with an overview of the what and the why of participatory and arts-based research with adolescents. Then I wanted to share 2 case studies from my own research. And we'll be talking about some of the benefits and the richness of this type of work, but also some of the challenges and the messiness and the difficulties. And in that, I'll be sharing some examples as well around intersubjective identity, and specifically about some of the difficulties and the methodological and ethical challenges of someone from a positionality like mine, who is white, English speaking, much older than the young people we're working with, and foreign. And in some cases also a woman conducting research with adolescent boys and young men. At the end, we'll have some time for discussion, and I've prepared about 25 to 30 minutes of content. So to start out with, why adolescent health? So adolescence is a really important demographic population as one of the world's largest and fastest growing populations. And adolescence is also a really important time in the life course. So it's been described as a sociobiological window of opportunity comprised of major physical and social and development transitions. And adolescents clearly possess an incredible creativity, dynamism, and potential. At the same time, many also face acute barriers, including many live in contexts of instability or face multiple and intersecting vulnerabilities that can exacerbate one another. There's also a health impetus, and today I'll be talking about 2 specific health issues, one a direct one, which is around HIV and AIDS-related illness, which is the second leading cause of death of adolescents across the world, and the first in Southern and Eastern Africa. And the second is actually an indirect effect, which is COVID-19. So although young people aren't bearing the burden of COVID infections and deaths, there's also indirect effects that there's been a suggestion that young people are really bearing and having to shoulder the burdens due to structural, social, economic, COVID-related issues. So clearly, adolescents have needs that we are not doing a good job at meeting. They've been described as wicked or intractable and difficult to solve. So we need to find tools that facilitate and boost young people's meaningful participation. There's also limitations of single research approaches and using different methods, including participatory and arts-based methods, alongside other more traditional methods, can guard against the bias of a single method. And also interdisciplinarity can really help us understand things in much fuller ways. Now, participation is a spectrum with benefits as well as limitations. And today, I'm not presenting it as some sort of gold standard, but really just some lessons learned and some successes and stumbling blocks that I've come into along the way doing this work. Last, art-based research, there's been a suggestion, it's a particularly great approach for working with young people because it can leverage their creativity and strengths. And at the same time, reduce the biases that might come from being afraid of saying the wrong thing, especially if the researcher you're working with is an adult. So I thought this quote summed up the why of participatory research really well. So by definition, if a group is marginalized, their views are often absent from policy and programming, which has a further exclusionary effect. So there's been a suggestion that participatory research might be one way to hopefully start to shift that a little bit and to get the views and perspectives and recommendations of really important voices that are often not heard into the conversation. Now, some of the central tenets of participatory research, and I won't spend a lot of time on this, but just to say it's really interested in power and shifting power and through the research process. So as where traditional methods might do research about young people, participatory research would aim to do that research with them or even have adolescents or young people run or lead on aspects of research. It's an iterative process of inquiry and action. And the idea would be that it would be great to have adolescents involved throughout the whole research cycle. Now, one of the main aims of this is what Freire refers to as building critical consciousness. That is an awareness and be able to situate oneself within the dynamics of one's situation and reality in order to identify and action sites of resistance. So having given that brief overview, I wanted to jump right into the first case study. And this is a study of, it was actually my doctoral work. It was conducted in the Eastern Cape. I did my doctorate at the School of Public Health and Family Medicine. And it was with adolescent boys and young men living with HIV. And to share a little bit about the impetus for this research, I wanted to go back in time. So many of you will be familiar with Nkosi Xolani Johnson, who was born with HIV in South Africa. You can see this picture, he's making history. He's addressing the International AIDS Conference in Durban in July 2000. And at the time, he was 11 years old and the oldest known child born with HIV. He was an activist and he called for the South African government to roll out AZT to prevent the mother-to-child transmission of HIV. Now, sadly, in the year 2001, at the age of 12, Nkosi died before ART was made available. Now, from this really sad story, two things stayed with me that I thought would be important to discuss and elaborate on today. The first was at the time, although these medicines existed, incredibly, they were not made available to the people who needed them. That has now changed, and with the public sector rollout of ART, antiretrovirals are available in South Africa to adolescents living with HIV. The second thing was really the amazing work of this young person. So he was an activist, and even though he was young, he was able to powerfully advocate for the issues of young people living with HIV. So today the issues look different. And although antiretroviral therapy is much more available, age-related illness is still the highest cause of death amongst adolescents in East and Southern Africa and the second worldwide. And this is largely to challenges with pill taking and adherence to ART. At the same time, another group that struggles to be retained in the HIV cascade of care, or that we are not meeting their needs, is men living with HIV. So although women and girls are disproportionately affected with HIV for both biological and social reasons, men test less, seek treatment less and later, and are more likely to die of age-related illness. And we won't go too much into it, but there's a suggestion that there's two interrelated reasons for this. One is the way that the health system is set up and provisioned, so supply side barriers, and then also challenging norms of masculinity, which equate illness with weakness and weakness with emasculation. So what my research aimed to do is look at people at the intersection of these two identities, so adolescent boys and young men living with HIV. And I specifically selected a life course approach. And the reason why is, although we're experiencing our health and our bodies right at this moment, of course, our practices and our experiences are formed throughout the life course. And they can also be interrupted or sustained based on certain experiences and events and conditions in our lives. And before getting into the nitty-gritties, I just want to give you a bit more background about this study. So it's conducted in the Eastern Cape in a mixture of urban, peri-urban, and rural areas as part of a larger mixed methods study, which received ethical approval through the University of Cape Town. And the sub-study that I worked on specifically used qualitative and art-based methods with adolescent boys and young men themselves. And I'm going to walk you through a little bit of what the data looks like. Now, I know this is a really busy slide, but I just wanted to share kind of how we engaged three very different methods together. So in the middle, what you can see is an adolescent boy participant who is mapping out his life journey using the metaphor of a river of life. And you can see the image of that in the top left corner. On the right is a sanitized version of his clinic file. So with consent, we went to all of the health facilities where participants had ever engaged health services and pulled out their clinic files to look at their life histories told from a different perspective. And then we also did in-depth semi-structured interviews with participants. And there's two things that I wanted to highlight, and I hope the screen is big enough in order to see this person's life history, which is on the top left. So the first was some of the ways that the use of art showed us things that we wouldn't have been able to get at through other more traditional methods. So you can see that he positions himself close to his mother, his sister, and his grandmother in this image. And he does so around the home that he grew up in. And this both demonstrates the physical proximity of his household, but also the emotional proximity to these people in his family. By contrast, you can see far away on the left-hand side of the screen, his father, who he didn't know and he did not live with. He also used emoji stickers, and we ended up selling out of all of the emoji stickers in East London in this research to express challenging life events. And given that adolescents and adolescent boys and young men might have different levels of comfort verbally expressing certain feelings, we drew heavily on social media imagery and a language that participants seemed much more comfortable with, which was of emojis. And you can see he used an emoji, he used sad and crying emojis to depict a very difficult life event, which was the death of his mother. And you can also see on the far left an angry emoji to express how he felt about his father. You can also see the proximity of his father and his finding out of his own HIV status. So although he didn't explicitly state this, he also alluded to linking his HIV positive status to his father. He also spoke about anger towards his father for another reason, which is that the absence of his patrilineal kin from his life had effects on his well-being, because as someone coming into adult manhood, he needed rituals and ceremonies from that side that he did not receive because of their absence. So that was just really a kind of a drive-by way to show a little bit about how one specific art-based method can provide different types of information, and then also how it triangulates. So you can see on the right, his clinic file tells a similar story, but in a really different way. So it talks about the death of his mother as well, which is an important life event that he mentioned, and also him becoming sick with tuberculosis and having a very low CD4 count, which he also mapped out and spoke about in his life history narrative, but from a perspective of becoming ill and finding out his HIV positive status. And it also demonstrates his relationship and his proximity to his grandmother. So just one way to show how art-based methods can also be used to triangulate and strengthen data across methods. I also wanted to share two other images from life history narratives to demonstrate something that I learned through this research, which is that when you open things up and you ask young people to share, you're inevitably relinquishing some control over the outcomes, over the inquiry, over the topics that you'll be discussing. And because of that, you might need to respond to things that you're not expecting. So in the image on the top left, you can see a participant mapped out his life history using a lot of metaphor, including rocks for difficult times, a bridge for a positive time. But you can also see on the top right that he drew a shark and someone throwing themselves into the water. And he wrote that time when you give up on life and you're thinking of committing suicide. So this was a disclosure of a retrospective suicidal ideation within an interview, which was something that, although we weren't expecting, is a really important thing to obviously respond to. And in our discussion, I'd be happy to share a little bit more. And I see my colleague Nokubonga Releo just joined the room as well. And she'd also be able to share, I'm sure, some of the examples of how we've responded to some of these difficult and unexpected things. The other I wanted to share briefly was that adolescent boys in this method opened up and spoke quite a bit about their challenges of taking medicine during traditional COSA initiation, where they're circumcised and initiated into manhood. And it was very common for us to hear things like, if you are found taking medicine, you'll be called names and considered less of a man. This applied not to just the 1 month of initiation, but also the time following, where they returned to their communities and were highly visibilized as new men. And this posed, a number of methodological and ethical challenges. I wasn't expecting, as someone who is foreign and a woman, to be up close to something that is a highly secretive and sacred aspect for many people in a tradition. And it threw up some challenges about how we both collected the data and also honored the data and also honored participants in the tradition itself. And I'd be happy to chat more about that and answer any questions on what we did if you would like in the discussion. The next case study that I wanted to share is very different. It's part of research that's housed within a big research hub that's focused on health and development on the continent. And there's 40 adolescent focused studies in 20 countries. Angelique also works with us on this hub, and I saw Nokubonga joined. I'm not sure if anyone else on the call is working with us. I can't see the whole gallery. But while this hub is quite a big project, the embedded study that I have worked on is with adolescents in 3 sites in the Eastern and Western Cape, as well as in Kisumu, Kenya. And we've engaged participatory methods as well as art-based methods. So here you can see at the bottom some participant generated methods using the arts. And what we really wanted to do in this study is think about what methods worked for engaging young people meaningfully and how they wanted to participate in research. So our first order of business was actually to determine some key tenets of participatory research that we would workshop with young people themselves. So at the top, you can see we're workshopping research and the research cycle. In the bottom right, we're using embodied as well as word association activities to workshop concepts of power and participation. And then young people also told us using different arts-based methods how they wanted to participate. And you can see on the top right-hand corner, this was expressed in many ways, but a very common theme was wanting to participate as equal partners in research. And one of the things that was always a consistent theme in this work is how adolescents not only have the capacity to understand, but they're enthusiastic and engaged and able to participate as knowledge co-creators. We also had some empirical questions, you can see here some images from work across the different sites. Any images of participants were taken and shared with parental consent, as well as child assent if they're under the age of 18. And we asked adolescents to help us set priorities to inform study design. So they generated and grouped research questions and topics that were important to them. And here you can see in one of the images, democratically voting on the most important issues that they wanted to do more research about and take forward. So we had this research study, we were engaging research in person, and then in March 2020, everything shut down. And we really didn't know what to do. We didn't know if we should be doing research with adolescents and young people, although there was a huge question in terms of how they were doing and what they were experiencing. And we also didn't know how. And as adults and as researchers, we're often used to calling the shots and being in positions of power, really. And so we started racking our brains, and some people thought that we should, do research over WhatsApp. And then in the end, we did the thing that makes the most sense, but sometimes is counterintuitive. We just reached out to the young people over the phone and we asked them what they wanted to do. And because we had built strong relationships and because they understood research, they were incredibly responsive and gave really, really helpful advice. So they first suggested that we should do research. They thought it was important to document adolescents' experiences during this time, and they suggested a roughly framed question around COVID-19 experiences, challenges, and coping. And they also had some methodological suggestions. So we thought maybe they'd want to use WhatsApp, but they suggested Facebook. The reason being that they all had Facebook, and it can be used in a way that minimizes barriers to accessibility. So Facebook can be used password protected on multiple devices, which means you don't need to have your own phone to participate and you can log in and out. And it could also be used data free in South Africa. Participants wanted to keep conducting research together because they had very strong group identities. And they also wanted to use multiple mediums, which Facebook allowed, like pictures, writing, and videos. And of course, these were done in closed Facebook groups. And what we did is we ended up designing what we call the Facebook time capsule. So a pocket where we could fill it up with experiences of COVID-19 and also look back on it as an archive. And we ended up conducting 28 activities over a period of 10 months of data collection. Because the calls also went really well and were quite rich, we ended up calling back all of the participants we could reach and also interviewing them using that method. And I wanted to share a few examples of how of different activities that we used. So this one, and we were really intentional methodologically about this activity because this was a time when people were asking what type of information adolescents needed about COVID-19. And so we wanted to understand how young people understood COVID as a starting point. And we tried to frame it creating some conceptual distance. So we asked them to explain it to a being that is not from this world, that wouldn't have received information before. So they could really kind of whittle down what their understandings were and explain them. And here is one example of some of the data that we gathered. It is presented as it was put on the Facebook page, except for some of the language was in Xhosa. So what is presented here is translated into English, but the form is kept. And you can see young people, many of them displayed incredible biomedical understandings of COVID-19. They screenshotted images of the virus. They wrote about or drew about how it's transmitted and the symptoms. One cheekily said that she would just teach the alien how to use Google so they could figure out for themselves. And then another, and we'd often use animal imagery in different activities to create conceptual distance. And this young person picked up on it and talked about the transmission and spread using the imagery of a cheetah because it's easily and quickly transmissible. And here's some other information that we also got, and I'm sharing this to kind of demonstrate the breadth of data and the breadth of perspectives, and often their multi-layered nature in terms of understanding COVID-19. And obviously this is really important to understand the layerings of how young people make sense of the virus, and also for policy and response. And this first example also shows how participants engaged with one another about it. So you can see on the top left one talking about not seeing a difference between COVID and Ebola because they saw that it was transmitted the same way. They thought it had the same side effects. And then another participant came in and said, nope, I don't think so, and screenshotted the CDC symptoms of Ebola and shared it. On the right, you can also see, and this came out quite a bit, especially later on around, as vaccines have started being rolled out, around the belief in the very existence of COVID-19 as conspiracy related. And I just wanted to share one more example. And this is an example that was actually led by Angelique for an activity with support by Nohubanga and other colleagues. And I just wanted to share this to give you a sense of the different types of data that we got and the ways that participants engaged. So here you can see an example of, we used metaphor to talk about resilience and coping, using body image of the head, the heart, and the hands and the feet. And I wanted to share a participant's response from the first one, which is around our thoughts and beliefs, or our heads. I'm going to unplug my mic to do it so you can hear, and I hope it works, but Angelique, maybe you can just flag to me if you don't hear anything.
Beginnings for their original hope and possibility. I choose to focus on what I can change. My strength is greater than any struggle. I am deserving of hope and healthy love.
So just a snippet of how some participants engaged the space to share about their coping and resilience practices during COVID-19. I know we're almost out of time, so I'm not going to spend too much time on the next slides, but I just wanted to show you some examples of some of the other things that we have done and are doing with this data. So we were able to engage a local artist to help us visualize some of the data with the mind to re-engage and check with the young people who produce the data for validity, and also to share it in a different way, maybe a way that might be more accessible, and also that young people could also share onwards to represent the work. So here you can see an image of a situation that a couple participants described who were pregnant or gave birth during COVID-19, especially right at the beginning when there wasn't a lot of government support or service provisions. They described buffering against adversities and food insecurity with the support of concerned neighbors and social support networks in their communities. They also described feeling really stuck, being at home and feeling like they're having trouble moving forward with aspects of their lives, such as studies or work, and not really having space for themselves to do the things that they felt like they needed to do for the next phases of their lives, which of course is really important for this group, many of whom were finishing high school or transitioning into the workforce or pursuing further education. Participants also described challenges with mental health and coping in relation to both isolation and concerns over not having basic necessities met. And I wanted to share other spaces where we've also put together and shared this research. And part of the reason for doing this is, look, there's a lot that's said in academia and in policy world about qualitative and participatory and arts-based data not being as rigorous or valid. And here are some examples of evidence to impact, where the value and richness of co-generated data with adolescents what did receive different types of uptake. And I wanted to also share this with a bit of reassurance, because as qualitative and participatory research, it's important to know that your data is really important. Of course, it's important to validate and understand young people's experiences, but it can also have a lot of meaning and come into spaces that govern policy and decisions. And to leave off, today we've talked about some of the challenges and difficulties with participatory and arts-based research, as well as some of the incredible benefits as well. And there's two key thoughts that I wanted to leave you with. The first is that people think adolescents are hard to reach, that they aren't able to participate, or they're not interested to participate, or that we know better as adults and as researchers. And as you can see, this isn't true. It is possible for adolescents to engage and participate actively and meaningfully. They have important insights and can co-generate rich and relevant data. Second, it's important for this to be done because adolescents are a very specific part of a population that is not situated within power. And that is additionally true for adolescents at the intersections of multiple forms of vulnerability and marginalization. And engaging with these methods can hopefully be a start to rebalancing some of this power and be one of the reasons that it's important to engage this next generation of people. So I'll leave it there, but just to say thank you very much. And of course, thank you to the amazing teams and funders and people who have supported this work. And I'd love to now hear what you think.
Thanks so much for this talk. It's the first time that I actually saw the visuals of the data, and that's really exciting. And I especially appreciated the way in which you spoke about participation and the involvement of young people as co-creators, showing the ways in which it's worked for you, but also the stumbling blocks you faced. I will now ask if there's anyone who would like to ask a question or comment on the presentation. You can either raise your hand on the Zoom feature or pose a question or comment in the chat if you feel more comfortable with that. Chikezi, I see your hand up.
Yes, Angelique, thank you so much. Let me start by saying to Leslie, fantastic presentation, brilliant. I really learned a lot from your presentation. It's easy to follow. It's fascinating work that you're doing. Well done. And just to reiterate some of the main point, the punchline from your presentation, which is that research on young people, especially in this COVID-19 era, and their health practices is very under-researched, because when we keep talking about the pandemic and the impact and all of that, children and young people are mostly neglected because we think that their voices and their views do not matter. Because, yeah, so there should be more intensified research in that area. Completely agree. And just also to say, I mean, I'm a postdoctoral researcher at HUMA, but I've also been researching young people and children for the past 7 to 8 years. So it's an area that I'm very much interested in. But I have never used the art-based participatory research. So I find it fascinating, and I would. So I'm kind of thinking of, yeah, doing it one of these days, but just to hear from you what it is like. For example, if one wants to combine focus groups like you did, focus groups, semi-structured interviews and all of that, how do you have a separate method that you call art-based participation method, or do you bring in the art-basedness of the work into the focus group discussion, into the in-depth interviews that you want to do? How does it work? And yeah, I really like to know. And perhaps also, if you'd be kind to share your email, maybe privately or on the chat, I would like to contact you later. Yeah, thanks.
Leslie, can I just ask, do you want to take another question, or would you like to do it one at a time?
What do you usually do? I'm open to either. I really loved your input, so I don't want to lose any of them. So
go for it.
Okay. So I'll put my email in the chat. I'll actually do that right now. It sounds like you're doing really interesting work, and I'd love to connect. And in terms of your question about combining methods, it's a really good one. And to be honest, I think I do it in a very exploratory ways, and often driven by both the the research question as well as participants, right? And that can take a bit of trial and error. So for example, even at the beginning of a traditional focus group, it doesn't mean you can't start with embodied activities, for young people to express themselves in different ways. Even if you're going to then use a more traditional method, it can build rapport, right? There's also ways that I've worked in kind of both. So for example, what I found to be really helpful is to say, do an activity. For example, a word association activity where what is one of the main topics that you're researching, for example, with young people?
Their use of digital technology, their health practices. Yeah,
right.
just like, yeah.
Amazing.
Yeah.
So like with something like that, I would think about, are there embodied or enacted ways where we could learn about those practices using, say, theater-based methods where we pose them a question and ask them to show us something? Or if you wanted to, say, generate associations around, say, beliefs around the use of technology, something I'll often do is use word associations. So I'll put young people in groups and I'll say, you have like 1 minute to put down all of your thoughts about this topic. And you can use sticky notes, and then you can look across them and get them to group them. So actually to thematize themselves, the topics. And then you can run a focus group based on that, where you dig a bit deeper into some of the questions. So there's so many options. And I think it's really great to do hybrid models of participatory and more traditional approaches. I think the only thing is really planning time for it. So making sure that it's iterative and you give enough time. But I'd love to hear about your work and share anything I know. And also, I'm sure you have lots that you're doing that we could learn from as well. So
thank you so much. I'll reach out later. Thanks.
Okay.
Thanks, Chikezi. Thanks, Leslie. Aza, would you like to go? Aza, I think you're speaking, but you're still on mute. Will it not let you unmute? Oh, there you go.
Okay, thank you very much. Thank you, Leslie, for your research. I really liked it. And I also liked the aesthetics, the colors, the drawings. It's just amazing. It's really fascinating. My question is regarding ethics of research, and especially the age of your participant that you are working with, and also the condition of their HIV patients. And yes, so you mentioned a bit of, you said consent, but it would be great just to reflect more, because I'm also at home and I'm going to do research about health, and using apps. So I think I would benefit from like personally, I would benefit to know exactly how did you go about with this, ethics clearances or consents, all those, like unpack them for us. And I also, another thing also I found it interesting is when there's this quote when they say that if they are taking pills, they will be seen as less men. Like it's, I would like to also like you to unpack that kind of statement. So what is it exactly? Why are they seen in that way? Why are they seen less men? Who is seeing them as less men? So yeah, thank you very much.
Great, thank you. Those are amazing questions. So the first around ethics, it's a huge field, and it's one that's very complex and challenging, and I certainly don't have all of the answers. Of course, at the University of Cape Town, for any research with human subjects, you have to fill out, an ethics approvals. But I think we also need to think beyond, just, the REB or the institutional approval, because something that's really unique about this age group is that 2 16-year-olds can be very different, right? In terms of their maturity, their understanding. Participants have different life experiences and language, and also say the very young adolescents we work with in Kenya in the age group of 10 to 14 are very different from a group that are transitioning out of their teenage years, right? So I think one important thing is, as much as possible, to have age-appropriate content. So even our consent forms are designed with social media imagery. We say things in different ways as well, and we also pilot those with young people themselves to assess a comprehension. And I think something that has been really valuable there is having groups of young people that we work with as advisors who really understand research, because we've workshopped research, we've workshopped power and participation, because it's one thing to consent to do something, but it's another thing to know what a peer-reviewed paper looks like, right? Where some of your data might be published, or a report. So I'd say those are ways we do it. Try and be conscious of the age group specifically and design everything through that, and learning from adolescent advisors as well, who can help kind of navigate some of those things. And I'm happy to chat more about it too offline if you'd like. And the second one was around the quote about masculinity and pill taking. I mean, I didn't go much into this. I'm happy to also share more, including kind of community and publications that we've come out with about that work. But basically what happened is, so our research was in the Eastern Cape. It was mostly with Xhosa boys and young men. And there's a traditional practice called uwaluko, which is about basically being initiated into manhood. And during that time, there's a lot of rules. Some are very secretive. There's a number that aren't secretive. And one of the non-secretive ones is that you're not supposed to engage with biomedical products and services during that time, because the idea is then you're somehow using a crutch, or you're weak, or you're unable to heal properly otherwise and go through the process. So that's extended to other medications that aren't safe for pain relief, like chronic medications for, say, HIV or diabetes, and there's a lot of stigma around medicines taking. And if you don't go through that process properly, you might never be considered a man. You might be considered a perpetual boy. So within this particular context in society, there was a lot of pressure and a lot of importance in following the rules properly. And this came into conflict with boys living with HIV's health practices and their imperative to take HIV medicines, which they also felt was really important. And they described feeling really conflicted, like they were coming up across two different forms of stigma, a certain type of masculinity related stigma and an HIV related stigma. But the other thing that they did is some of them managed to negotiate taking medicine while at initiation secretly. And what we did is, and this wasn't done by me, this was done by two young Xhosa men who were ethical advisors as well in the research and collected the primary data, is we generated some of the strategies that, that boys use successfully. And then we also shared them broadly through NGOs in schools in the Eastern Cape, so that boys who were going to be coming across this issue, not just for HIV, but for other issues, also could draw on the experiences of those who had gone before them and done it successfully. So yeah, that's a little bit more on that one. I could talk all day about it, but yeah, I know we have other questions.
Thanks, Azza. Thanks, Leslie. Amina.
Thank you. Hi, thank you so much for your talk and for all the elaborations. I have a question acknowledging that HIV should not be stigmatized. I'm really curious about how you situate your able-bodiedness and along with the research team when doing such research. And I'd love if you could just speak a little bit to that. Thank you so much.
Thank you. And it's a great question. And it's something that, I didn't, reflect on in the beginning about positionality. But of course, ability and able-bodiedness is also, an intersecting form of privilege. Now, HIV, is interesting because it's also often invisibilized, right? And because of stigma, like you said, it's often not spoken. Most of the participants in the research were not at the time significantly ill, right? So they weren't, although they were living with HIV, it wasn't necessarily visible externally. That doesn't mean that there weren't, of course, like really important ethical and methodological challenges, some of which I think, frankly, we got right better than others. So one of the things is the whole study was framed as being around health practices more broadly and not HIV, so as to not stigmatize participants and also to understand multiple intersecting health issues. And there was a whole protocol. I see Alona's joined this call as well. Hi, Alona. Alona is one of the principal investigators on that study. But there was a whole kind of confidentiality protocol, which we also had and followed, obviously, to protect certain, private aspects of people's identity.
Thank you so much.
Thanks, Amina. If it's okay, while we're waiting for more questions, I'd like to ask one. That's okay. So many of the fellows on the call are planning and preparing for fieldwork during a pandemic. So how can creativity and engagement be fostered in a context where signal and data pose enormous challenges for young people, like in South Africa, for example?
Right. So I think it's a really great question. Again, I don't have any answers, but I have a few thoughts. One is there's some excellent resources out there, including I'm forgetting her name. It's out of Australia, Deborah Lupton's work on research during a pandemic, which was crowdsourced from lots of different spaces and different environments with different degrees of access and reliability to technology and data and network. What we did, and we found through Facebook, is Facebook can be used data-free, but only for certain things. So we actually factored in and budgeted for transferring data to participants so they could participate. The other nice thing about doing something on social media is if someone's network is down, it doesn't happen in real time, so they can also engage when they come back online. And also platforms where you can log in and out of mean that people can share devices. But that said, it does not account for probably those who have the least access. If you're in a household without any access to technology, or in an area that doesn't have any network or connectivity or power, that's going to be really hard. So what we did in Kenya, for example, is we didn't do any social media based data collection because households had phones, but they were not smartphones. And usually it was one person in a household that had a phone. So then we tailored the method to what was more doable, which was telephone calls. So I would say really to survey what people's access is and find ways and get creative about finding ways, including if you have people you're piloting with, asking them to let you know what would be easiest for them. And the other thing I'd say is a lot of patience and budgeting for additional time and costs that might be associated with pivoting. But the other thing that I think is really important to note is we can generate really different types of data with these different methods. And young people are very fluent, a lot of them in technologies and social media, and they can also lead research in a language that we're not as comfortable with, right? So I had to, Knox will laugh, but I had to go live for the first time on Facebook. Well, I guess now this is my second time, but that's something I'd never done before, right? I tend to shy away from social media, maybe even a bit more so from someone in my generation, which is, a couple decades past the age of those young people. So there's possibilities with it too, but it requires being really creative and thinking outside of the box and taking the lead from young people.
Thanks, Leslie. I just wanted to check the chat and make sure there aren't any questions in there. So if there's anyone who has a question, you can pop it in the chat, but you can also raise your hand. Okay, there's a hand. I can't see what it is. Chikezi, I think.
Yes, thank you. Leslie, I was just wondering about something. The interviews that you had during the pandemic, that is, you couldn't be physically present with them, and then you opted for phone interviews. And I was wondering if you sort of brought in the app-based participation inside it and how it played out because it was not physical.
That's a great question. And I really have to take my hat off to Nokubanga, who's in this call, because she's the one who led most of those calls. So what we did was they ended up being quite rich, especially in South Africa, and participants were actually quite willing to talk and share about their experiences. We did ask questions that were a little bit indirect to try and get at different understandings that weren't art-based. So for example, we asked the question, if COVID-19 was an animal, what animal would it be and why? And what we heard from participants was a lot of, gosh, I'm gonna forget, but there was a lot of snakes, you know, something that's kind of come out of nowhere, but that's deeply threatening, some lions, some pests as well, like mosquitoes. So that was one way to kind of generate non-traditional data to understand. But we didn't, oh, actually we did do something else, which, and Angelique actually led it, which was when things quieted down a little bit, we delivered notebooks, participatory notebooks to young people's homes with different prompts in it, as well as art supplies, so they could engage and then repost on social media. In Kenya, we also asked young people to do activities like writing a letter to themselves. But I must say, I don't think in either of those cases, we ended up closing the loop very well, in that we didn't call back to re-engage on those same methods. And that's, I think, one of the challenges of this type of research is it's very resource intensive, because it's not like you're together and you can just check in on things. Every call requires scheduling, data uploads. And so I think that's something that can be done, but probably would require a little bit more intentional planning and resourcing around if you're engaging an art-based method that you then want to follow up on and use iteratively on the phone to actually make sure that you're kind of iteratively following up and checking in and providing the support that's needed, which is a bit harder when you're not in person.
Thanks, Chikezi. Thanks, Leslie. I also wanted to know, what does meaningful participation look like? I mean, you mentioned meaningful, and I think I hear that so often, and I don't actually know how to create necessarily what would be the ideal standard of meaningful. So maybe if you could just unpack your thoughts on that, or even your experiences from the work you've done.
Yeah, great, Ange. I feel like that's the million-dollar question, right? And it's something that I still grapple with. And I think it's a process. I don't think it's something that you ever get to. And I think by nature, meaning is, you know, it's subjective, it's constructed, and it's co-constructed. So because of that, it's really difficult to do a checklist. It would be so easy if we could just say, oh, do this and this and this thing. But then you run the risk of kind of having an adolescence to a research study and stir type approach, you know, rather than one that is actually trying to really meaningfully engage adolescents. So what does that mean? There are a few guidelines from UNICEF and an amazing organization called Youth Power, which we're working on now to actually craft a statement that involve things like trying to engage adolescents at all stages of the research cycle, making sure that research is done with them or at some stage of participation and not just about them. And then also being ready to engage what you have heard and learned iteratively, right? And I think the ideal, so there's been a suggestion that participation happens on a spectrum and that power sits on a spectrum, right? And in the middle, maybe you have participation. On one side, you have something that's more interactive. On the other side, you have something that's emancipatory. And on one side, adolescents are involved, and the other side, they're actually leading it. And I think that meaningful participation, as long as it's negotiated, can happen in all spaces of that spectrum. But I think it's about being really clear and thinking about what are the objectives of the research? How will you support young people to understand and participate and feel safe to do it? And what are the methods through which you'll do that? But I'd love to hear other thoughts as well, because it's certainly not something that we have figured out just yet.
Thanks, Leslie. Chikezi, is that a hand from the previous question?
Yes, sorry.
Okay, no problem. Just checking the chat if there are any questions. Okay. I wanted you to speak a bit. You spoke about how, as a woman, but also as an outsider, you were privy to events and practices that are usually secretive. Could you speak about how you navigated the situations, but also you mentioned that you honored the data and how you can do that through publications, but what do you mean when you say you honored the data? I guess I'm interested just to know what that meant.
Yeah, so I would say that we strived to honor the data and to approach the work from a place of learning and unlearning and humility. That doesn't mean that that I got it right, and it doesn't mean that there weren't harms either. And it's something that I think, I've navigated with a lot of discomfort, a lot of sleepless nights. And I guess what I've come to is first, engaging research topics that I think are important, and that there's, an evidence, both empirical, but also from people's experiences around responding to really problem-driven real-world questions that impact people's daily lives. I think another aspect is really through what I've talked about here, which is participatory and arts-based approaches that in some way unseat kind of the centrality of the researcher, and create space for young people and participants really to share and drive both the empirical and the methodological work, and to co-create. So I think that's one aspect. In terms of the work in the Eastern Cape specifically, which involved a very different demographic group to my own, we did a lot of consultations. So there was a long-standing research team in the Eastern Cape that we workshopped this. So we sat with together and we said, who should be doing this work and how should we be doing it? And then we based our recruitment of research assistants, training of research assistants, and then the method based on people who had longstanding experience with young people who were from that area. We ended up hiring and working closely with two Xhosa young men who were also ethical advisors on the research. And what they would do, so a practical example is if there was an interview that had anything to do with initiation, they would do the interview. They were both initiated men. And then they would filter out any data that wasn't central to the research question and that wasn't something that was broadly known, like the rule around taking pills. So if they spoke in the secret manhood language, for example, they would actually advise me not to listen to that interview, and they would transcribe it into English. And then they also acted as ethical advisors in terms of how and where we shared that information as well, and ways to do it that upheld the tradition and what was secret in it. Yeah, does that answer your question, Ange? But that to say,
Yes.
there's aspects that I'm sure we could have done better, and ways I would do it differently in the future too. So it's a constant process of reflection, right?
Thanks, Leslie. So we have 4 minutes left. If there's anyone, I'll probably take another question if there is, but I also wanted to let you know, Leslie, that Ilona said, thank you for a brilliant talk. And Ruth said, thank you for a wonderful and thought-provoking presentation. And then I just wanted to read, there was someone asked, please describe your experience working with an adolescent advisory group for your research process, including how the groups were formed and how this benefited or enhanced the research. Did you also use arts-based participatory methods for the advisory group?
Right. That's a great question. And so just to say, the second case study was all with advisory groups and how we worked with them specifically. So in this case, they both advised and they were also research participants, right? So they wore multiple hats. The formation of those groups was done in different ways. So the first was actually formed 12 years ago by Professor Kluver at the University of Oxford. And it was, they were recruited as part of a mixed method study. The second one was also a group of participants that were recruited from 2 studies in the Eastern Cape. And some of them were recruited also directly from my doctoral sub-study in that. So what we tried to do in recruiting those young people was young people that we knew enjoyed participation, group activities, they liked talking. And so that was kind of how we recruited them. And then in Kenya, we also actually worked with a partner organization called the Center for the Study of Adolescence that works with adolescents and community organizations working with adolescents across the country. So we worked with them to set the inclusion criteria, and they did a school-based recruitment process, first with principals and then teachers, and then nominated participants from their schools. I know that's not a full answer, but I know time's a little short. If you have any other questions, I would love to hear from everyone and also about the research they're doing. And I've put my email in the chat.
Thanks, Leslie. So thank you firstly for this insightful discussion and taking the time to be with us, Leslie. My hope is that participants would leave here today having learned from your experience and work, but also that this would be the start of an even wider conversation on how to develop methods in research with adolescents and young people that involves them as co-creators of work that affects them. As we end, I'd like to alert all guests to upcoming events. Our next doctoral seminar will be held on Wednesday, the 27th of October at 4 p.m., where Dr. Leah Junk will present a talk titled Tendering into a Methodological Cul-de-sac, My Voyage of Exploring Interconnections. All future events can also be found on the UMA webpage. That's uma.uct.ac.za. Thanks for joining. Take care and stay safe, everyone.